with Miss April Rovero, and she is from the NCAPDA. We're just gonna be talking about substance abuse. So I guess like our first question is like a brief introduction about your role in mental health specifically and substance abuse, and kind of like what the NCAPDA does.
Okay, sure. Well, I am the founder and the executive director of this organization, National Coalition Against Prescription Drug Abuse, and we're based in San Ramon, California. We just had our 10-year anniversary on June 2nd, 2020. So we're pretty proud of that because not all nonprofit organizations survive as long as 10 years. But we have a group of very dedicated people. Absolutely, I am myself, and a great board of directors that have stuck with us, and lots of other followers that have allowed us to do our work. And so our mission is to prevent prescription drug-related substance use disorder, also known as addiction, and also overdose deaths, and largely through our community education programs. We do a little bit of policy change where we have that opportunity on the local, state, and federal levels. And we also do some legislative advocacy work also where we have that opportunity both at the state and the national level. But I would say 95% of the work we do is all community education around prescription drug safety. And our focus is typically on painkillers, also known as opioids, prescribed stimulants. This would be drugs like Adderall and Ritalin that can be abused, even though they have a medical purpose, just like painkillers do. And also sedatives. This would be things like sleep aids, including Ambien, and then also benzodiazepines such as Xanax and Ativan and those kinds of drugs. And so our link to mental health, to answer that question, we see an absolute nexus, a correlation and kind of cause and effect relationship between substance use and sometimes abuse and mental health. It's not uncommon for people to kind of generally self-medicate, when they have anxiety or they have depression, or they're having these feelings, mental health episodes where they really don't understand what's going on so much, and maybe they don't seek out professional support as they should, and instead maybe they're drinking alcohol or they're smoking marijuana, or they may be using prescription meds because not everybody takes the time and effort to lock them up. And so drugs are pretty easily found in medicine cabinets because of that. And it's real easy to say, hey, especially for young people, my mom, I know, has been taking Xanax. Let me go get a Xanny, and see if that helps me deal with my anxiety. Right now, we have so much anxiety with the COVID situation. Everybody's feeling a little anxious one way or the other. And so we're especially concerned about the mental health issues that could drive substance use that could become a disorder.
Oh, and yeah. So sort of going off that, I kind of wanted to ask why exactly you chose to start the NCAPDA.
Well, that's a great question. It's a very personal reason, but I'm happy to share with you. My son, Joey, and my husband and I moved up to Northern California from Southern California when Joey was entering third grade. So, he moved out of a parochial school setting where, we'd had him placed in Southern California into the San Ramon Valley Unified School District. So he went to Bollinger Elementary, on to Iron Horse Middle School, and he graduated in 2006 from Cal High. And so Joey goes off to college in the fall, like I'm sure many of you will, if not most or all of you. And he had chosen Arizona State University to go to. So Joey's going through his freshman year and moving right through. He's about 5 months away from graduating from college when we got the devastating news that he had been found in his off-campus apartment where he was living with a couple of his fraternity brothers. And ultimately, we learned that he had died from a prescription drug overdose. He'd been out with his friends the night before, and they'd gone to the nightclubs in the area, just kind of celebrating the end finals, the end of the semester, and like everybody was leaving to go home for a winter break. Joey was expected home the next day. And so, he was drinking, but he combined the alcohol with prescription meds that he had been prescribed by a doctor 9 days before that included painkillers, a muscle relaxant called Soma, and he also had been prescribed Xanax. So ultimately, we learned that the combination of alcohol mixed with Xanax and the painkillers, the roxicodone specifically, had basically shut down his breathing. He went to bed after being out with his friends that night, and he did not wake up. So he died. And, as I started, first of all, trying to deal with this just absolutely horrible loss, just devastating loss, I was shocked to learn ultimately, when we got the coroner's report about 4 months later, that he had died from such a small amount of everything that was mixed. It was like a pill of Xanax and, a pill and a half of oxycodone, the equivalent, in a system. And his alcohol level was just over the legal driving level. And my perception before had always been like, okay, I'd heard about Elvis Presley and some of these other stars, that make the news that had overdosed. And I just assumed they took a whole bunch of stuff, a bunch of pills. And I was completely shocked to learn that it would take so little to kill a perfectly healthy young man, 21 years old. And I just really, we were open and didn't, shared everything we knew about his death as we learned more and more. And I found that nobody knew any more than I did about how dangerous these medications could be. And as I looked at, what is it that I can do personally to make a difference with this problem, ultimately I decided that forming an organization, because nobody else was talking about this. We had other prevention groups out there, but they were not focused on prescription meds at all, nor was our county. I just felt like that was a way that I could make a difference. Joey had all the potential in the world. He would have graduated, and just like 5 months later, he was almost done with college. He would have had a communications and a business degree, and really smart guy, all the potential in the world. And I really wanted his life to, in the end, mean something, So, working with his story, telling it to everybody I talk with, and being willing to also couple that with the education that I have since learned, myself about prescription meds, then I feel good about what I'm doing every day. I feel like I'm making a difference. And in Joey's memory, I'm making a difference. And, his memory lives on through me and in my work. So that's a long answer to your question, but yeah, that was it.
Thank you for that. Yeah, and I'm very sorry for your loss.
Yeah, thank you very much. It's really hard. But you're getting the word out too. So, this video will go out there. So you're providing an opportunity to help him live on too. So thank you.
Yeah, I really just, first of all, I can't even imagine going through that. And the fact that you created this, I just really want to appreciate your efforts, because I think it takes a lot to step up and want to create change. And a lot of people don't do that. So I just wanted to first applaud you for that, because I'm, especially after something like that, I can't imagine.
Well,
and
on one hand, I just want to say too that another piece of it is to help you cope with the grief. The parents I know around the country, I know hundreds and hundreds that have lost their kids too, or other family members. If you don't get involved and do something with your grief, it can consume you and kill you. Literally, people get sick. So it has helped me personally cope with that loss. That 10 years later, it still affects me every single day. It's a tough loss. So.
Especially with issues like these, I feel like they're really stigmatized. I mean, personally, in our community, I do see people just tend to have negative perceptions of issues like this, and speaking out about an issue like this, I think, is also really brave. So.
Well, and you guys are doing the same thing, and I loved the work you're doing too. So
thank you.
Mental health and addiction, substance use disorder, as we've renamed it, to try to eliminate that, that stigma. We need to talk about this stuff, and there is a coupling, there is a connection between the two. So thank you for the opportunity to share, and let's work together. We can together make a difference in breaking down stigma and, helping people understand better. Mental health is a fact. It's out there, and we need to address it. It doesn't help to sweep it under the rug, right?
Definitely. Yeah, so that kind of leads into like our next question. We were just like, I know you work with multiple age demographics. Like, what would you say is the most common? And like, is it common for teenagers and children to be dealing with drugs and mental health issues and things like that?
Oh gosh, it's such a great question. I would say that it doesn't discriminate. In terms of drug use, I kind of classified, it in a little bit different ways. So little kids, we're talking toddlers, they can get a hold of medications that are just left casually out on the counter or whatever. These pills are pretty, they're colorful, they look like candy. So little kids can overdose. They call it poisonings in their case, but they can die. They usually survive because there's an adult around, but not always. And then you've got the teens, and mental health issues can start, I believe, from what I'm understanding, as early as elementary school. They start to become more pronounced and obvious as you get into middle school, and all the pressures, social pressures, and sometimes family pressures, whatever, start to, cause maybe a little bit more angst and issues with mental health. But that's when you can start to see, I think,